The difference between an allogeneic and an autologous transplant depends on the donor source. So with an allogeneic transplant, the donor is somebody else. It'd be as if I were donating my bone marrow to the patient. With an autologous transplant, the term auto means self. With an autologous transplant, you're donating to yourself. Okay. So we're taking out your own stem cells. By the way, you'll often hear me maybe on this talk, or if you ever talk to me in the future, use the term bone marrow cells, stem cells as interchangeably. So with an autologous stem cell transplant, autologous bone marrow transplant, we're taking out the patient's own stem cells and then giving them back in that reseeding process. There have been multiple studies, or I shouldn't say multiple, but there have been several studies looking at comparing allogeneic transplants in neuroblastoma to autologous transplants with no advantage seen with the allogeneic transplants to date, in part because there are many more complications with allogeneic transplants that aren't seen with autologous transplants by using a donor that's different than self. So over the last 30 years, the standard has been to, in North America and Europe and Asia, has been to use a patient's own bone marrow cells, their own stem cells, in that reseeding or transplant process over a different donor's cells, which would be an allogeneic transplant.